Hi, we're going to talk about the different stages of labor. There are 4 stages, not counting pre-labor. So we're going to start with early labor and the stage of dilation. And here is a diagram that shows the different stages of dilation of your cervix. So as you're preparing for the baby to come down, your uterus will be contracting and the cervix will dilate in order to allow the baby to be born. So once it starts to dilate at about 1 centimeter, then this stage of labor progresses. It becomes stronger as the baby descends in the uterus, and the uterus begins contracting a little bit harder. The contractions come closer together. There's a little bit less time in between as you move from early stage of labor to active labor, and then eventually you hit what we call transition, which is at the moment that the cervix hits 10 centimeters of dilation, which is the maximum, and that's when you're ready for the birth. So again, the stage is broken up into different phases. There's early, active, and then transition when you hit that 10 centimeters. Now you're going to have a couple of sensations as you move into the next phase of labor, which the beginning phase of the next stage is the pushing. So you'll start to feel a strong desire to push. It may feel like you're going to have a huge bowel movement. It may feel like you just have a lot of pressure on your bottom, and you will have that sensation that you need to push. Sometimes when you get to the point where you're going to push, now you're in the second stage of labor. This is the stage where you are going to give birth, and that's from 10 centimeters dilated to the time the baby is birthed. The first stage of labor is the longest stage of labor. The birth stage is a little bit shorter, but probably the most intense phase of labor. So once the baby is born, you're going to move into the third stage, which is the birth of the placenta. So once the baby is born, it's still going to be attached to the umbilical cord, and the umbilical cord is attached to the placenta that will begin to detach from the uterine wall, also descend down the uterus and down the vaginal canal, and eventually will be birthed. So after the baby's born, there's a little bit of a reprieve. Mom, just gave birth. There's usually a lot of jubilation and tears, and then mom starts to feel a little bit of cramping again, and then there's some bleeding. So if she's not already on the bed, oftentimes we'll get the mom on the bed in a comfortable position, and when she starts to feel that cramping, she'll start to feel a little desire to push. It won't be nearly as intense as the birth of the baby, but it will, there'll still be that feeling that she wants to push that placenta out. Once the placenta is birthed, there'll be some blood and a little more cramping. Now we are moving into the fourth stage of labor. So at the beginning of this stage, which lasts really from here on out, is that the uterus is going to start to contract down to its normal size. So mom's going to feel some cramping, and she's going to still feel some uterine contractions. Now, one of the things that precipitates some of those contractions is the release of oxytocin as the mom breastfeeds the baby. So if the choice is to breastfeed and the baby is latching on, the mom will feel some more of those contractions, and that can happen within the first few days of the baby's life as that uterus gets back down to normal size. So there might be some contractions, bleeding. This is when mom might decide she's really hungry now that she's done all this work, labor and delivery. She may be hungry for something to eat. She may be thirsty, and it's time to rest. There's a period of time after the baby is born, especially if there have been no interventions, where the baby is pretty alert for some time. It's a great time to get the baby to latch on. Mom is kind of enjoying her new baby, and the baby can latch on, and then they can kind of move through recovery and into the postpartum phase from there. So those are the 3 stages of labor. First stage is the stage of dilation from 1 to 10 centimeters. The second stage is the birth of the baby, where the baby enters the new world. The third stage is then the birth of the placenta, where there's a little bit of bleeding. And then the uterus can start contracting and coming back to normal in the fourth stage, which is recovery.